What happens is that in the last 1 month or probably last 2 weeks before the exam, you all must have had taken some leaves. If you haven't applied, then please do apply for some leaves before the exam. RChem exams are difficult. They require focus study. At least 1 week or 2 weeks apply for leaves. Even if you do not get leaves, get your shifts shifted. Like you can exchange your shifts. But it's just like if you have even done throughout the race, but in the last 4 to 5 minutes, if you do not race well or run well, you will not be able to win. Similarly, in your exam preparations as well, in the last 1 month, then comes to last 1 week. If you aren't preparing with much focus, then you won't be able to retain the knowledge. Primary is all about basic sciences. Basic sciences is not like you need to retain the facts. Retention is when you revise more and more. One, I will discuss the causes of the failure as well by the end of the this presentation. So this is the reason why when they confuse you in between the basic facts as well, since you haven't revised well, that is why you get confused whether this is the answer or this is the answer. Okay, so we should be starting without further delay because it's a 1 hour session. Shalom. So there aren't any questions so far. Stay tuned onto the Facebook page. In the last 1 month, we will be sharing some of the questions, also some of the recalls from 2016 to 2024. So for the past around 8 years, recalls on and off, some of the questions will be shared onto the Facebook. And so do try to answer them, and the answers will be posted. So Bismillahirrahmanirrahim. So now this is the structure of the RChem examination, post-graduation exam for the membership of Royal College, and it consists of 3 parts. Part A and Part B are theoretical, and Part C is the OSCE examination. This is conducted in London, Malaysia, and India, and intermediate and primary can be taken online in the PSMU centers as well. Primary examination is a 3 hour paper. In one go, you need to attempt 180 questions. So with this perspective, see, you have 180 minutes to solve 180 questions. So the time is very crucial in this. This is the reason why do try to focus on some of the areas so that you try to gain some sort of minutes from some of the questions, and do you utilize that time in solving some of the difficult questions. The difficult questions that come up that the candidates tend to find is usually from the anatomy section, or usually from the microbiology or the pharma. Physiology, the candidates find it a bit easier. Okay. Then we have the MRCEM SP or the intermediate examination. Now here there are 2 papers with a gap of 1 hour in between, and each you have it's your choice whether to take the break or not to take the break. But here also you have 180 questions, but they are divided into 2 papers. One paper is of 90 questions, the other paper of is another 90 questions, and then you have a 1 hour break in between. In the MRChem primary, to appear in this examination, no previous experience in the emergency medicine is required. You only need a valid license and a valid degree to apply. Now, currently, those who are appearing in October, this is the DIE 2 of this year, and it's 30th October, and the result is on 4th December. And in the next year, the first DIE is going to come up onto this 22nd April. It will be held. Fees, this is for the non-members international candidates, which is the majority of us is the non-members and the international candidates. So this is the RChem calendar of 2026. That is 22nd April, and then the other date is 27th October. For all those who are, if there are some of the candidates who do not know, there are some of the candidates who do not know about like the RChem, they are going to pursue this post-graduation. And now they are thinking to appear in that. Since RChem exams are held only twice a year, right? In a diet, try to appear the diet which you get in 4 to 6 months. Like for those candidates who are planning to go for the for this MRChem, April diet is fair enough for you to prepare well. 4 to 6 months is more than enough to prepare for any exam. Okay. And so the application dates that will open is in 10th December. This is what the candidates miss out, that in this year only you need to book the exam for the next year first night. Okay. And it will close on 17th December. This is the curriculum. So in the basic sciences curriculum, you have anatomy and physiology. Now let me annotate these slides. Yes. So this is anatomy, this is physiology, pathology, pharma, micro, and evidence-based medicine. I haven't added this, but I'll drop this in the WhatsApp group as well. For those who don't know, who are new, anatomy and physiology constitute around more than 50% of your exam. So please focus on anatomy and physiology. Pathology, pharma, and microbiology and evidence-based medicine. Out of these four, then give priority to pharma, then give priority to micro and EBM, and then give priority to pathology. From anatomy and physiology, in the last diet, 58 questions were asked. So could you imagine that around 58, so around like 116 questions, like around 120 questions came from anatomy and physiology. A candidate who just does not focus on anatomy and physiology as much, when he sits for the examination, now this exam you need to give it in one go. Okay, you do not have time to regain your confidence. Okay, you have a break in 1 hour, and you do not do well with anatomy and physiology, and you have 120 questions. So how can you expect yourself to pass the exam? So anything which is explicitly told to you, so you need to then study smartly. So your now, if like 1 month is left, I'm not counting that last 10 days. If last 1 month is left, so your 20 days should be on anatomy and physio, and the one that is the 10 days should be on micro, pharma, EBM, and pathology. 58 were only questions came from anatomy, and then 58 from physiology. Now, if you divide this, if you have a look at this curriculum, let me just again clear the slide. So if you just have a look at this anatomy only, how many slots are there? Around 6. They were, suppose they were questioning around 58 questions in the last diet. So if we assume that, okay, in this diet, they question around 60 questions from anatomy, you have a margin of around 10 questions from each. Imagine 10 questions from upper limb, 10 from lower limb, 10 from thorax, 10 from abdomen and pelvis, 10 from head and neck, and 10 from cranial nerves. So this can be the revision. Usually in anatomy and physiology, the much more focus is on upper, lower limb, and thorax. And then comes the cranial and the head and neck, and then comes the abdomen and the pelvis. Physiology as well, if 58 to 60 questions are coming in the last diets, you know the pattern. Then from each, they are going to, there's basic cellular, respiratory, cardiovascular, renal, endocrine, and then there is also a GIT. Okay, so 6 slots over here, 10 questions from each will be coming. Pathology in the last diet, around less than 10 questions came, which was, to be accurate, only 8 questions came. So see, for 8 questions, do not spend much more time on pathology. Okay. From the pharma, around 30 questions to come, or 20 to 30, like 23 can be, like less than 25. And then micro comes, and then EBM comes. EBM is something that changes from diet to diet. There are certain diets in which 11 to 12 questions were asked, and there were certain diets in which even 17 questions came from EBM. One of the common things that candidates do is leaving out the EBM. It's just like mathematics. Do not skip anything completely. If you have less time, then okay. focus on only the high yield points. At least rote learn the high yield points which will be shared in the, which are shared in the classroom. Even the third batch candidates are added in the classrooms. So you can just rectify those high yield points for the EPM, because they cannot dodge you in these questions. They come as it is. So if they ask you, you either you know it or either you do not know. If you know it, you will be saving around 30 to 40 seconds from each question, because you know it and you will just answer it. If you do not know it, please do not spend time in thinking about EBM questions. Then just take any of the options and move to the next one. Because if you spend more than 1 minute on one question, then you will be like compromising on the time spent on the upcoming questions. Okay. The stems are not so long in the MRCEM primary. Okay. Do not expect long stems to come. They are very comprehensive, two-liner questions are coming. Okay. For the preparation course outline that is going to be conducted is in this month is 20th September till 20th October. Duration is 1 month and it's from 8 till 10 p.m. The classes will be held for all those candidates who are part of this course. Rest assured, the classes can go beyond 10 p.m. and they will go beyond 10 p.m. I know, because anatomy and physiology will take time. So it's in between, we can take 5 to 10 minutes of break, but do schedule your timetable accordingly. That we can go beyond 10 p.m., like 10:30 till 11. 5 classes per week is scheduled, but it can be 6 classes per week as well. And the more than, like for instance, in the last course as well, I did not expect it, but when we calculated, around more than 77 hours of teaching was conducted in the last month, in the last batch, that was in the last 2 months. So accordingly, we just focus on completing or teaching the entire theoretical knowledge. So when you teach the theory, it takes time. And why we are teaching the theory, I'll tell you. This is important. Okay. WhatsApp group will be made for the third batch by tomorrow, inshallah. And over there also, the high yield points will be shared, and on and off the questions will be shared. The last 1 month and 10 days, now the WhatsApp groups will become active. Okay. So, and for every important topic, for instance, anatomy and physiology is important. So we will be doing the theory and then we'll be doing the high yield MCQs. High yield points are shared in the classrooms, and that's it. So the high yield MCQ session will be conducted of those topics which are very, very important. For the rest of the topics, we'll share those high yield MCQs in the WhatsApp group where you can answer them. Okay. Now, there's just a pattern, a layout for you to help out how you can divide your timeline in this last month. I'm not counting the last 20th October till 30th October. I'm not counting that. There's a question. The rest time, 5 to 10 minutes for break, is including or out 3 hours related to the exam? There is no rest time in between the exam. I was talking about the course. For the exam, it's around 3 hours paper, 180 questions with no break in between. Okay. Mm. So there's a layout for a timetable, how you can divide. Now you know that only 30 days are there. For instance, if you assume 30 days are there for you to go through the syllabus again or start the preparation from the scratch even. For that, 10 days is for the anatomy and 10 days is for the this thing, physiology and the 10 days for physiology, 10 days for the anatomy, and the rest of the 10 days will be divided into pharma, micro, patho, and EBM. For instance, if you're starting from 20th September, now this is for your personal timetable. This is not our course timetable, but this is for your personal. You know, 20th September till 1st October, you need to cover anatomy chunk. And now in the anatomy, you know, the main focus is on upper limb, lower limb, and thorax. Give them 2 to 2 days. I'll read the chat box by the end of the session and I'll answer, inshallah. Okay. So, for instance, So give 2 days for upper limb, 2 days for lower limb, and 2 days for thorax. Then 1 day for abdomen anatomy, 1 day for perineum anatomy, 1 day for cranial nerves. Now the CNS and the cranial nerves does take time. Either head and neck portion will take time, either the cranial nerves might take time. But I know that the theory is extensive. Obviously, the 12 cranial nerves, and to retain that knowledge, it will take time. So you can take around 3 days for CNS and cranial nerves, depending on your which area is strong or which area is weak. Now, for this is for your personal time. Now, for every topic, you need to do three things. Theory, which is the comprehensive theory, it is given in the classroom. But that theory is different from what is being taught in the class. So this is why your live classes are very important. The comprehensive theory file, then the other is the solve MCQs file from the MRCEM Success subscription. It's up to you. If you want to take a subscription, you can take the subscription, buy the subscription. Ideally, we do not recommend the subscriptions because obviously the solved PDFs are given to you in the Google Classroom. The questions that appear in the exam, they are entirely different. They are not as it is the subscriptions. They are very two-liners. Questions are coming and they are testing your theory. I never took any sort of a subscription for any exam. So similarly, you also do not need. You only need to know the pattern of how do they ask the questions and how to brainstorm it. And that's it. You can do it from the PDFs that is given in the classroom. Then the third thing that you need to do is the high yield points. Okay. Now, for instance, you sit on 20th September and you start your upper limb anatomy. Complete the high yield, complete those two things. That is the high yield points and the comprehensive theory. Do that, revise that. On 21st September, solve all the questions of upper limb anatomy and you are done and dusted with upper limb anatomy. On 22nd, then again go through the high yield points, theory of the lower limb anatomy, and on 23rd, then solve all the questions of the lower limb anatomy. Why? Because upper and lower limb anatomy questions are more. There are more than 100 questions in the MRCEM Success. So they will take time. And in the last 1 month, I do expect you all to be spending at least you would be spending at least 6 to 7 hours on your personal study time. At least 8 hours you should be spending on studying. So if you're spending 8 hours, yes, you can cover the theory, you can cover the high yield points. Okay. Then you coming towards the 24th of September, you start off with thoracic. You open the classroom, you go through the comprehensive theory of thorax, high yield points, then revise them. Please, it's not just one read, revise them. On 25th, only do the questions. On 26th, then do the anatomy of abdomen and solve the questions as well. Now 27th, do the anatomy of the perineum, solve the questions as well. Now here, when you have one day, these are crucial days because you need to do the theory as well as questions. But in the MRCEM Success PDFs, the question number is less for the anatomy of abdomen and perineum. It's doable. Cranial nerves, head and neck, and CNS, it's merged in the MRCEM Success PDFs. You will be able to solve them in one day, and in one day go through the theory, in the other day go through the theory of the cranial nerves. So 3 days for that. Whenever I'm saying you do the theory, then please revise them. Anatomy is very volatile. You will tend to forget that. So by the time you jump to physiology, you might forget anatomy. But you will be able to retain the anatomy if you at least revise twice at this point. Remember, this timetable will end at 20th October. You still have last 10 days. What to do in last 10 days, I'll tell you. If you feel it's okay, you can follow this timetable. Now, in the 1st October. Now, 1st October is any sort of an anatomy, like a mock or a high yield MCQs. Like you can randomly pick out all the high yield points, go through them, and randomly pick the questions and solve them. The questions which you did wrong in the first instance when you were solving the questions over here. Okay. Now, in the 2nd October till 11th October, again, another set of 10 days is left. Now you can divide your physiology. Now in the physiology, basic cellular physiology is very like, it's the same as you did in the medical school. Okay, the homeostasis mechanism, the positive and the negative feedback, that's it. The diffusion, facilitated diffusions, all those concepts will not take time. You can do the theory as well as the questions in one day. Okay, so like 4 hours you spend on the theory and 3 hours you spend on doing the MCQs. Now this is a focused study time. You do not you are not having any sort of distractions in during this entire time. Third and fourth, respiratory physiology will take time, because to retain the tidal volumes, the force vital capacity, the factors affecting all these will take time. So better allot one day, that is 3rd October, on doing respiratory physiology theory. Once you do the theory once, then again revise that theory. On 4th October, only do the high yield points and the questions of the respiratory physiology. 5th October, start off with serious physiology. Theory is very, very comprehensive. And on 6th, do the questions and the high yield points. Whenever I'm seeing high yield points in theory, at least do it twice. 7, GIT physiology is very comprehensive. Even in our course as well, it's a very like a 2 hour or 1.5 hour session, very comprehensive theory. Just do it that bit only and solve the question. It will take one day only. Renal physiology is a bit extensive, and since it's not very much clinically not applied, so that is why candidates do take time to retain the renal physiology. So spend one day, entire day, for the theory of the renal physiology. Revise it. 9th October, solve the MCQs. 10th. On 10th, do the endocrine. Endocrine is easy. You do the theory. And then on 11th, you can do the questions of the endocrine, plus still some time will be left. Endocrine is also very comprehensive. Now, the time that is left, all those areas that you did wrong in a sense, when you were doing the respiratory physiology questions, right? You know that, okay, you were being stuck in the volumes. You were doing the volume questions wrong. On 11th October, revise the volumes. You came to know that, okay, in the calculations or in the laws, like the Henry law and in the Dalton's law, you were confused. On the last day, revise those laws. All those weak areas, do revise them when you end one section. Okay. So this was related to the physiology. Now, you are done with anatomy and physiology. Now see, when you say 10 days for anatomy physiology, it seems like you have a lot of time, right? But when you divide it in between the sections, see, very less time is left. There are certain topics, only one day is supposed to be given to those topics. So please always try to make up a timetable, because then you realize that not much time is left for the preparation. Only then you will be able to. Then coming towards the pharma, micro, patho, and the EPM as well. Now, in pharma, micro, patho, and EPM, you know that pharma, now, so I told you this, if there's someone who's unmute, let me mute. Okay. In pharma, micro, patho, and EBM, you know which to focus most and which to focus least. Pharma should be focused more. Patho is supposed to be focused least. Now, out of these 10 days, at least allot 4 days to pharma. 4 days to pharma. And then then give 2 days to micro, 2 days to EBM, and 1 day to pathology. Pathology is less than 10 questions are coming, so only do the high yield bits and try to solve the MCQs. In EBM, focus on learning the theory, the bits like the formulas, the definitions, the type of the studies. There are certain questions that they will ask you. There's not much thing that they will confuse you about. Okay. Microbiology, it's like, again, it's something that you need to learn. 16th, allot 1 day to learn the theory. On 17th, only solve the MCQs. When you are doing only the theory, also do the high yield points. In microbiology, much of the questions that are coming are one-liners actually. So from the high yield points, try to memorize that. So from the high yield points and the theory, you will do it on 16th, and on 17th, you will solve the MCQs. Now, when you're talking about these 4 days when you need to do these 4 days when you need to do this pharma, right? Pharma is a bit extensive. Just like physiology has every bit, right? CVS physiology, respiratory physiology, GIT, renal. Every bit has a related pharma as well. But we do not spend much time on pharma as you are spending it in the physiology. Remember, less than 25 questions are coming in pharma. So you need to be smart enough. When you sit to study general principles and ANS pharmacology, keep this in mind. If you're studying 6 hours per day, then only spend around 4 hours on the theory, and you need to keep this in mind that, okay, I need to leave 2 hours to solve the MCQs. You should be done on one day with theory and MCQs. Then come to this theory, MCQs done. Theory, MCQs done. Theory, MCQs done. So whenever there are days when you're doing theory MCQs, could you realize that there are two chunks that you need to cover? Two chunks that you need to cover. Two chunks that you need to cover. So this will be a little bit challenging for you, but it's doable. Why? Because you do not need to learn everything, because you know only less than 25 questions are coming. So this is known as that you study smartly. You divide your time. You know that, okay, today I'm going to give this much time. Divide the number of the hours. Keep the number of the hours separate for your questions, and keep the time of the theory study separate. Then now let me have a look at the chat box before I proceed. If you want to go, you are allowed in between the exam to go to the washroom, but that time is not separate. You are not given a separate time for that. Please share the schedule on WhatsApp. Okay, I'll share. What are the other resources of questions other than the MRCEM success subscription? Now, okay, I am coming on the resources. Okay, I'll discuss that in that what are the resources that you could do, like two types for the theory as well as the questions as well. Okay. So what are the common causes of the failure when we talk about this? So what do you think what are the causes of the failure? If anyone can comment in the chat box. What do you think would have had been going wrong with some of the candidates? I even had candidates who were there, like I will not obviously name them, but I had candidates who appeared for the exam twice, and then in the third attempt, then they passed the exam. They attended my course as well. They were a part of my course, and then they passed. Inability to revise, time management, not revising. Yes, yes. Very good. Yes, Dr. Asha. Yes. Mm-hmm. Any other? Hmm. Now, for instance, time management and not revising. Yes, this is for the not revising and not completing on the material. This is now there are two things. One is before the exam that you have time, and one is on the day of the exam. On the day of the exam, first let's decide for the day of the exam. If the time management is not adequate, then also why? Because then you will be even not be able to solve those questions which you were even confident about if you do not manage your time. So please do manage your time adequately, right? And that's okay. Now this is on the day of the examination, right? That's not much playing a role. Before that, what happens is one of the most common cause of failure is when you start your preparation, candidates start the preparation directly, buying the subscription and start solving the questions. A very common cause of failure. When you start solving the questions directly, You just subscribe and start solving the questions. And whether it's your last month or whether it's your last 4 to 5 months, your mind automatically gets preoccupied with what they want to focus when they will be studying that respective topic. If you directly start solving the question from the upper limb related to the Hornboller's test or anything related to like teres minor or the rotator cuff muscles or the test, when you will study the rotator cuff muscles, your mind will be preoccupied with the tests. You will forget to even look at the nerve roots of those nerves supplying the rotator cuff muscles, and the nerves are questioned. Which nerve supplies the supraspinatus, infraspinatus, teres minor? This is the common cause of failure, that you start solving the questions directly. Please do not start solving the questions. Previously, candidates used to ace the exams by directly solving the questions. And today, even if you ask those candidates, they will guide you that, okay, just buy the subscription, just please start solving the questions, and that will help you ace the exam. Yes, it was doable at that time. Now, with the passage of time, as RChem as this MRChem exams have been, the hype has been created. You all know that there have been seats have got booked. There are many candidates from my candidates only. They were unable to reserve the seats in the centers. So the centers have been getting booked. Previously, they were not getting booked. Now they are getting booked. Now you know more candidates are pairing, so now the exams are getting difficult. How do they get difficult? They get difficult when the pattern of the preparation remains the same and the pattern of the exam gets different. So how it is gotten different is they know what is there in the subscriptions. Everybody knows that. Even the RChem knows what's there in the subscriptions provided. So right after, those questions are not going to come, first of all. Yes, the content is going to come. So they now focus on the theory. Okay. So for those who go through the theory thoroughly, they are able to ace the exams. But those who only rely on the questions and only start solving the questions and only read the description, I have seen candidates doing only this, solving the questions, reading the description, and that's it, then moving forward and then moving forward and then saying, okay, we are done with the upper limb anatomy. And this is the reason why you, for instance, from one topic, you only know ABC, but RChem asks you XYZ. And then on the day of the examination, you struggle. So please do not rely on the questions only. Rely on your theory, especially for anatomy and physiology. This is not just for MRChem primary, this is also for MRChem SBA. This is also for OSCE. This is just for creating I'm just creating, if you do not know, it might be in sort of an awareness for you. In OSCE now, hybrid stations are coming. Not just one station comes. Like they do not test you on one line, hybrid stations come. When they are giving you a teaching station, they even test whether you know that you need to move this patient to the resuscitation or not. So they are changing their patterns. Okay, so please accordingly prepare. Then the other cause of the failure is, again, that's the time management, and yes, the revision. Your revision should be done at least thrice. Now, what is that? You first read the theory. You are done with everything. The first read, then you revise it again. In this 30 days, do it twice. In the last 10 days, this is the third time that you will be revising. And that's it. In the last 1 to 2 days, do not study anything new. Only the high yield pointers that are giving, just rote run and rectify them. That's it. In the last 5 days, do not solve MCQs. This is the common mistakes that candidates do. They are, before the exam also, they are solving the MCQs. Why are you exhausting your mind at that point? You need to keep your mind fresh at that point, that your mind is able to brainstorm at the time of the exam. If you have exhausted your mind a day before or a 2 day before in solving the MCQs, how do you expect with such adrenaline rush for you to perform well on the day of the examination? In the last 5 days, do not solve any questions. Just do the high yield points and rectify them. Like the nerve roots, you tend to forget them. Like the dermatomal origins, myotomes, do that. These are mark scanning questions and they definitely come. Now, coming towards the resources, in the resources, now there was a question that came up in the resources as well. Yes. For the theory, first we'll do the theory resources. For the theory resources, there's the book, textbook, there's the Isa Musa, there's also all-in-one notes by Dr. Saqib. You do not have now much time to do this Isa Musa, so I would not suggest you doing that. All-in-one notes by Dr. Saqib, it is comprehensive. You can go through that as well. However, in that as well, you cannot go through the entire bits. So in the classroom as well, you have the comprehensive theory. And for those who are registered, just go through the lectures and the comprehensive theory. That's more than enough. Even if you retain that, that would be more than enough. Okay. MRCEM theory, which MRCEM success theory is more than enough, Dr. Asad. You will not be able to retain that. Have you made notes out of that? Make sure you that from that respective PDF, that theory is volatile. Candidates tend to forget that theory actually. So for instance, if I did the MRCM success, so I used to make notes separate. You need to gather some sort of material which you need to go through by the end of the preparation time. Before the exam, you will not be able to go through the entire MRCM success theory, right? So if you haven't made the notes, then that's not an issue. The notes are already provided, the lectures are already there, just go through them. And if you have, then very good, you do that only in the last month. Okay, that's okay. That's more than enough. Where can we find all in one notes? I'll share that in the WhatsApp group, okay? Or in the Google Classroom as well. And by Dr. Sakib. Um, what was okay for the MCQs? For the MCQs, now we all know that there are the subscriptions that are available, MRChem Success and MRChem Expert, they are there. And then there's a pool of the recalls as well, which you do get from the candidates as well. That is, that they share the recalls and there are certain compilations as well. Now, in the high yield points that are shared in the classroom, some of the points that you could see are the incomplete sentences type with the question marks. So these are actually the recalls only that are there. And it is from 2016 till 2024. And then we have the MCQs that we share after the classroom as well. They are from the MRChem success mostly and mostly from the recalls. The high yield points are mostly from the recall. So you have two resources, either the recall or either the subscription. But even in that as well, you need to rely on your theory because it's basic sciences. Had this been an SB exam, I would then that's a clinical exam. And then over there, your MCQ solving, that ability is highly tested, right? That what they are questioning, what are the vitals, how to go about, how to read the question, what to focus on, what are the key points. That's a clinical exam. But this is a basic sciences. Please rely on your theory and make it, you should be able to focus on that. Any other questions so far? If we have time, we can start off with the upper limb bits as well. So this is the course that is starting. I'll share the all-in-one Isa Musa, the all-in-one by Dr. Saqib. That I'll share in the WhatsApp group, the official WhatsApp group. So for there are certain candidates who do not even want to like attend the entire course. They can even only attend the anatomy module as well. So that will be covered in that. Okay, there's a 4-day theme-based course that will be starting off from the 23rd till 26th of October. Now, this is something different. There was one of the candidate that asked me that whether this is similar by this course, that is the third batch course, will be similar to the previous course. That would be similar, obviously, but the 4-day theme-based course is it's something new that we are coming up. For instance, if I say to you that from the region of the brain, for instance, pons. Now, why the region of pons is important? There's something very different about pons, right? So the pons will be the theme, and why it is important, 4 to 5 points related to that, and how it has been tested in the previous recall. This is because certain set of cranial nerves and their um, they pass through that, or whatsoever that is, 4 to 5 theoretical points related to that theme. And one of the questions that has been coming, this is the way they design the exams as well, because they know this area is important. 4 points are reported to related to this region of the like this region, and now we need to test the candidate on any one of those points. So it's a something very different that I thought of coming up, especially when I had the resource of the recalls as well. So I am just compiling that. So this is a bit of, this will not be same as any of the previous courses. This will be entirely different. This will be theme based course. I'll just mention a theme, and that is why the time is very extensive. It's like 12 to 8 p.m. because in 4 days we'll be covering the themes from the entire basic sciences curriculum. For instance, cranial nerve, fifth, why it is important. What are the 4 points that are important related to fourth cranial nerve or fifth cranial nerve? And one of the recall that has come from the fourth cranial nerve. So this way we will be able to cover the regions. Now what we'll do, day 1 and day 2, we'll cover anatomy and physiology. On day 3 and day 4, we'll cover the rest of the 4 chunks, inshallah. So that's it for the introductory session. Any questions so far related to the preparation? Candidates that did not pass on 2 attempts, what did they do differently on third attempt? This thing they did differently, which I mentioned on in the start of the cause of failure. What they used to do was open the subscription and start solving the MCQs. They did not used to, and when those questions do not come up on the exam, so your confidence gets shattered, and then you are unable to solve the next question. Then they only relied on the theory in the third attempt. They did not started to solve the questions directly. If I give you a question from the tidal volume from the respiratory physiology, you have done that, right? And you start open the respiratory physiology. The first question comes to you from the tidal volume. Okay, you solve that and you read the description of the tidal volume. If I conduct a session on respiratory physiology, your entire focus will be somewhere or the other on the volumes only. You will forget that, okay, the laws were also very important. So this was the reason. Usually it happens when because people are going through the post-graduation exams along with jobs. So what they do, they subscribe, they just start solving the questions, and they think that, okay, by solving the questions, they'll be able to ace the exam. We'll try to cover a little bit from the upper limb, just 4 to 5 slides for those candidates who are going to join in the third batch, or for those who are new, that this is how we are going to go about, or this is how we are going to teach the anatomy module. Okay. Let me just open it up. We'll go about I'll just go about 9 slides from, okay, 4 or 5 slides from upper limb anatomy and few questions, because majority are those who are going to appear in October diet. So I assume that you might have had gone through the syllabus at least once. So you can go through that. Let me have a look at the chat box. What's there? You're welcome. Thank you so much. Okay, now. So this is how we go about with the anatomy of the upper limb. Bismillahirrahmanirrahim. So in the pectoral region, if you open now, you do not need to open the syllabus. Okay, so there's no time now to open the basic sciences curriculum syllabus. We have just jotted down what's important. In the pectoral region, muscles. Now this is for ma'am from anatomy, how many days you will cover all anatomy? We have 10 days. So in 10 days, we will inshallah try to cover that. And I have already told that in the 2 hour session that can go beyond. I know it will go beyond, it will be of 2.5 or 3 hours. But that should not be an issue for the candidates because it's for your exam only. So do try to take up that time and arrange that you have 1 hour of a leverage. We might take 2.5 to 3 hours per session, or might take 6 sessions per week. So in the pectoral region, now these are the muscles that are important: pectoralis major, minor, trapezius, latissimus dorsi, serratus anterior. And then there are two joints which are important, that is sternoclavicular and acromioclavicular joint. Okay. Now, in the pectoralis major, now this is important. Have a look at this. It's a pectoral muscle and it's a major muscle. Major muscle means that it has a major origin as well. We'll do the origin insertions in the upcoming slides. As for now, remember these four actions. It causes the flexion of the humerus, okay, adduction of the humerus and medial rotation of the humerus. It also keeps the arm attached to the body. So what action of this pectoralis major muscle is that this is the arm, it will cause the arm, it keeps it attached to the body. How to keep it attached to the body? By adduction, by medial rotation, and by flexion. If all three actions are bringing this towards the midline. So this is pectoralis major. Okay. Remember a Poland syndrome, it is a congenital anomaly. Now, this is something that is a malformation of chest, but this is something congenitally present. What happens in Poland syndrome? It is a type of a syndrome in which one region, pectoralis major, is absent. So the pectoralis major muscle is absent on one side of the body like this. This is known as the Poland syndrome. Okay, so these are the only bits that you need to know with respect to pectoralis major. Now, origin and insertion. It's a pectoralis muscle and a major muscle. So it is originating from a greater area. One is the clavicular head and one is the sternocostal head. Clavicular head, as the name suggests, it's originating from the clavicle. Sternocostal means this is sternum. Along with that is the ribs, costal. So sternocostal head. Clavicular head is specifically which area of the clavicle? The medial half of the clavicle. Sternocostal head, that is anterior thoracic wall. First 7 costal cartilages, that's it. So the anterior thoracic wall, anterior surface of the sternum, and the first 7 costal cartilages, from here it is originating. Okay. It goes and goes and goes. And then it inserts. Where it will insert? We have already studied pectoralis major is supposed to bring the arm towards the midline. So obviously it will go and insert onto the arm. Which region? It inserts onto the humerus, but where? In the intertubercular sulcus. Intertubercular means between the two tubercles, there is a sulcus or a groove between greater tubercle and lesser tubercle. One more thing important, since it's an RChem exam, they will ask you much more specific, much more difficult option will be given. What is that? Lateral lip of intertubercle sulcus. This is important. First, remember the major region. Okay, it inserts onto the humerus. Yes, onto the intertubercular sulcus. But which? The lateral lip. The sulcus has two lips. One is the medial lip, one has the lateral lip. That is on the lateral side, and one is on the medial side. So from the lateral lip of intertubercular sulcus, this muscle will insert. Okay. Now the function, we have already done that: flexion, adduction, and medial rotation of the arm at the glenohumeral joint. Innervation. Since it's a major muscle, a broad muscle, it was supposed to have the innervation from two nerves of its own name, that is medial and lateral pectoral nerves. Is this understood up till now? That's 2 to 3 MCQs are covered from this pectoralis major. Okay, perfect. Moving onwards. Pectoralis minor. From pectoralis minor, now again, its actions are, if you want, then we do the first the origin and the insertion. Okay. Now in the pectoralis minor, it originates, now it's a minor muscle, it's a small muscle, right? Origin is, have a look at this. The reason of having these pictures is for you to memorize at least. It originates from where? It originates from the rib 3 to 5. But which region? Anterior surface and superior border of rib 3 to 5. That's it. It originates from here, it goes and goes and goes, and it attaches where? Onto the scapula. Why? Because its action is related to the scapula. Okay. So it attaches onto the scapula, but which region? It attaches onto the coracoid process of scapula, medial border and upper surface. So it attaches onto the coracoid process of scapula. Rib 3 and 5, like 3 to 5, anterior surface and superior border, anterior surface and superior border, going and going and going and attaching onto the coracoid process of scapula. Action is to depress the tip of the shoulder or protract it. Okay, so it is protracting it, depressing the tip of the shoulder. Innervation is only medial pectoral nerve. But for the pectoralis major, it was medial and lateral pectoral nerve both. Okay. Now moving towards, now we'll do the actions. For the pectoralis minor, have a look at this. This is pectoralis minor. Rib 3, 4, 5. Superior border and anterior surface. This is the origination. It goes and goes and goes and inserts into the coracoid process of scapula. It then causes its depression. So it depresses the point of the shoulder. It elevates these ribs as well. It elevates these ribs. It draws the scapula medial and inferior, which is known as the protraction. Why are we studying this in so detail? There is one of the clinical significance is that this muscle actually, if you have a look at this picture, then you can appreciate there's an artery which is going. Okay. And what is that? At this region, this is known as the axillary artery. Pectoralis minor divides the axillary artery into 3 parts. What is that? Pectoralis minor is able to divide this artery in such way that one part lies medial to it, one part lies underneath or posterior to it, and one part of the axillary artery lies lateral to it. Okay, so there are 3 parts. First part, this is the second part, this is the third part. It is covered by clavipectoral fascia, which is pierced by medial pectoral nerve. So this artery, this muscle, this is covered by a clavipectoral fascia, innervated by the medial pectoral nerve. I hope so it's clear so far. So this is just for you to let you know. So this is what 3, 4, 5 elevation of the ribs, the action of pectoralis minor. What is this? Protraction or depressing the tip of the scapula, an action of pectoralis minor. Okay, so these were the few slides. We'll cover the trapezius and other muscles from the 20th September only. So this was just a flavor to give you all that this is how we'll go about in this when we'll study the upper limb anatomy. Okay. If you all have done some of the theory, if you all have done that, then we can solve 1 to 2 MCQs just so that I get to know how much you all know or at what level is your preparation. It's just to give you all a flavor. Okay. So for the anatomy chunks of the upper limb, lower limb, thorax, we will be having separate sessions on the MCQs. So please open up your chat box. That's okay. Even if you answer it wrong, that's okay. Completely fine. Okay. Let me just. So what is the answer of this? 65-year-old woman presents with history of pain and weakness of the left shoulder for the past 2 weeks. On examination, there is weakness of lateral rotation and you suspect infraspinatus pathology. The infraspinatus muscle is innervated by which of the following nerves? Good. Okay. Yes. So it's the suprascapular now. Moving onwards, some more questions. 34-year-old man present. Okay, when you are trying to solve the questions, as I've already told to my previous candidates as well, first read this line, last line. So your mind preoccupies that, okay, what do you need to search for in the rest of the question? So for instance, they are asking you, he is unable to maintain this position with his right arm as you push downwards on both the arms. So you need to actually test that which muscle you are testing. A 34-year-old man presents after injuring the right shoulder playing hockey. You decide to examine each of the relevant shoulders muscle in turn. You position him as shown below. Keeping this in mind, now tell which arm, which muscle is being tested. How many candidates do we have? Okay, 16 candidates are there. Okay, tell me the name of the test. Acha, this is a very common thing. Candidates get confused in empty can test and in lift off test. That is common. Okay. So there is a ambiguity in the questions. What is L test? Dr. Umar. Lift off test. Acha. Acha, Dr. Umar was not in my previous course. Okay. If you have had been in my previous course, though, I would have had dealt it. Um, okay. Okay. So it's a supraspinatus test. Okay. Now there are 3 points where you could have had answered it correctly. First is it was supraspinatus. Either you know it, that okay, supraspinatus is tested, or if you do not know, so jump to the second option. Second option was what? Look at the picture. So the picture is whether it's empty can or lift off test. Empty can is you are doing it like this, and this is the position of the patient, right? You are doing it like this, and the patient, then you see that if you is able to do that against resistance or not. Lift off test is, I'll show you the picture. When your arm is behind and you try to lift it off from the back and bring it forward. Now, for every muscle, the respective action is done. Jo, whatever the action is. Supraspinatus, what is the action of supraspinatus? It's abduction, right? To initiate the abduction. If I want to test that whether patient's supraspinatus is intact, I will check whether the patient is able to abduct against resistance. So here we are checking whether the patient is able to abduct against resistance. Okay. Now, once and for all, if you just have a look at, yes, okay. Just solve, we'll just go through 2 more questions, then I'll teach you how do we memorize this left of Dr. Umar. Abduction 0 to 15. I have made a one table, and that has helped many candidates in memorizing the type of the test, the name of the test, the innovations, and the muscles involved. So, answer. Which of the following muscle is primarily being assessed? Sorry, I was just looking. You are teaching a medical student how to perform the shoulder examination. You position the patient with her right arm fully abducted with elbow flexed to 90 degrees. You ask the patient to laterally rotate the arm against resistance. Which of the following muscle is primarily assessed? Now let me tell you, give you a hint. Okay, sorry, the answer is there already. So when you're trying to solve this, now for instance, Laterally rotate the arm against resistance. Which two muscles are involved in lateral rotation? Which two rotator cuff muscles are involved in lateral rotation? Which two muscles are involved in lateral rotation against resistance? Which two rotator cuff muscles are involved? Teres minor and infraspinatus. Yes. The sits is the mnemonic, right? The sits is the I was actually asking from the rotator cuff muscles. Okay, so the supraspinatus, infraspinatus, teres minor, and the subscapularis. Out of these, two muscles are involved in the lateral rotation, right? Infraspinatus and teres minor. Both of them will be tested. How they will be tested? Medical practitioner or the doctor will test the lateral rotation against resistance, but the pattern is different. When this is abducted and elbow is flexed, so it's teres minor. Okay. I'll show you the picture when it's abducted and which test is this. Which of the following movement is most likely to be impaired? When a patient has torn the most commonly injured rotator cuff muscle post-trauma to the right shoulder. Which of the following movement is most likely to be impaired? Now they are asking, first, you need to know which rotator cuff muscle is most commonly injured. You need to know the name. First, tell me the muscle, which is the most commonly injured rotator cuff muscle. And then what action does it does? That is the answer. Yes, Dr. Rasha. Yes, it was hornballer. Yes, I'll show you the description. When we are doing the MCQs, we do the MCQs related to one subtopic, 4 to 5 MCQs, and then I show you the description and the answers as well, like the theoretical. So I'll be doing that as well. Good, good. Yes. So it's abduction of the arm and it's supraspinatus. Yes, everybody good. All of you have answered it correctly. Very good. Yes. Supraspinatus muscle is the most commonly injured rotator cuff muscle. Abduction of the arm is that. So see, so this is how you need to know. Rotator cuff muscles are there, and now this is how we do that. This is how you need to remember. Supraspinatus, infraspinatus, teres minor, subscapularis. So I have tabulated it. This is the presentation, how the tests are there. Here, arm is abducted, elbow is flexed, lateral rotation against resistance. It is Hornboller's test, testing the teres minor. Infraspinatus, teres minor, both are involved in what? Lateral rotation. Over here, the actions are same. Over here, the innervations are same. This is empty can test, and this is lift off test. Dr. Umar, have a look at this. This is lift off. The patient tries to lift the arm, okay, but the medical practitioner is this, the one in glasses. He does not lets the patient lift off. So this is that you are testing whether the patient is able to medially rotate the arm. So that is a subscapularis muscle. We'll do this in details when study the we'll do the complete course. Inshallah, we'll do this table in detail. So that's it for today. Any other questions so far? Uh, that's it from the introductory session. Was there anything which I left? Any question? Hmm. Yes, the nerve roots are questioned. They do come up. Yes. And this is the reason why I try to memorize the nerve roots a day or two before the exam, because that's understood that you're going to forget those nerve roots, right? But you know that they will definitely come in the exam. So study smartly and do them in the last 1 to 2 days before the exam. which portion to start with from the anatomy, upper limb anatomy, start from that. In the second and the third row, is that abduction of the arm? It's the abduction of the upper arm. It's like supraspinatus nerve. Yes, 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 they do ask. That is why this was tabulated. Anything which is covered in the lectures that is actually very handy. They do ask. They have asked the nerve root of the suprascapular nerve. When the rotator cuff muscle is important, so they do ask. That is in the now, one is the Hornboller's test and one is the infraspinatus test. In infraspinatus test, your this the arm is not abducted, but the elbow is flexed. But in the Hornboller's test, it's like the Hornboller, right? So your arm is abducted. They will not give you the pictures every time of the test. They give you descriptions. This is the reason why you need to keep the pictures in mind and then correlate that, okay, this is the description that is given. So they, because they do definitely ask, because that's how it is clinically relevant. So that's it for today. Thank you so much, everyone, for joining the session. I hope so that it was useful. I will share the timetable in the WhatsApp group as well, the all-in-one notes as well by Dr. Saqib as well, and hope to see you all on 20th of September. Thank you. Thank you so much.